But what are some of the specific practices or philosophies you implement in your work to ensure the patient feels understood and supported through their treatment journey or management journey?
It piggybacks off of what we just spoke about, but I think it's respecting the expertise of that patient and the humanity of their experience, right? I think too often we get caught in the biomedical components of their experience where their lab tests and their x-rays and all these things, which can have a place. I'm not here to say that those things aren't important, but the human story that revolves around pain is often what drives it to become persistent. It's the loss. It's the not able to do the things that are meaningful to them. It's their life shrinking around their pain. Yet medicine still gets so stuck on wanting to interrogate tissues and blame everything. And nobody just listens to a patient. It seems easy, but I can't tell you how many people I talk to that have navigated a healthcare system where they're dismissed. The doctor wants to get to the next appointment. And I don't want to come across that. I realize that there's physicians who have all the best intentions in the world. I was probably operated in some of these settings in my past where they just simply don't have the resources to give the appropriate amount of time and things. And they're under pressure. They're burning out. They have compassion fatigue. There's a lot of issues that create maybe healthcare interactions where it's not the ideal situation for the humanity of the experience to come out. So I think understanding I think that's why I love having interviews with people like you and Gilletta and Keith and Trevor and Tom and others who are people that have been through it. Because I think it's important for us to not lose sight of that human story that accompanies pain. And it's one that, as I talk to you all who are lived experiencers it's one that I'm dedicated to keeping front and center when we have events, when we have conferences, when we have things, because honestly, I've learned more from that. I definitely have learned from continuing education within my profession, but honestly, I've learned more from talking with people who've navigated their journey of how to better help them than what next technical skill I'm going to learn in my craft. So I think I tell my students, be a good human. If that's the way you approach your care, you're going to probably do well. And what does that mean? This looks like it's been hard for you. I'm so sorry you've been through this situation. How's this impacting your life? Pretend it's your mother or your aunt. And it's not that we don't genuinely care, but I think we have this, I'm the clinician and you're the patient. No, we're two humans in the same room. I have my own struggles as a human. I've had pain and different things. I'm not there to compare to patients' pain, because obviously oftentimes they've navigated a much, much more difficult journey. But I think if you can take that approach of we're two humans trying to come together to make an encounter that moves them towards something that's meaningful for them. And I think too often we have a clinician agenda versus a patient person in front of us agenda that can get us stuck and struggling.